Now we're going to go back to the top of our agenda for House Bill 125, and this bill was for discussion only last week, and it's still before the committee, and Senator Sari is recognized to explain the PCS, and I believe he also has some amendments. So, Senator Sari, you're recognized.
Thank you, Madam Chair. This is the PCS for House Bill 125, and I do have 2 amendments to it if we'd like to take those up first.
Which one would you like to do first?
Let's do the easy one is the short one first. This is H125 ASH 19 version 3.
You're recognized to explain the amendment.
Thank you, Madam Chair. This adds on to page 2, lines 46 through 48, and rewrites lines. What it does is there's already a provision here with regard to international physicians. What this will do is expand the scope of it to allow an international physician to actually come and practice in a rural community, provided they're doing so under the supervision of a North Carolina licensed doctor. This is something that we're hoping to do to address some of the healthcare deserts in eastern, central, and western North Carolina, and I'd commend it for your passage.
Any questions for the bill sponsor on the amendment? Seeing none, we have a motion to approve the amendment from Senator Bergen. All those in favor, please say aye. Aye. Any opposed? The amendment is passed. Senator Sari, you're recognized.
Thank you, Madam Chair. Another amendment, this is 125 ASH 20 version 5.
You're recognized to explain the amendment.
Thank you, Madam Chair. This is an amendment. It does several things. And first, I do want to take a minute to thank staff, thank some of the folks that I met with over the past week to go over some of their concerns after the discussion. It was a really productive conversation that we had, and this amendment is really a compilation of a lot of those conversations. One of the things I'll go through if there are any specific questions, glad to answer, but it expands the definition of a law enforcement officer based on my conversation with the hospitals to understand kind of how their law enforcement on site works. You'll see an amendment there. We did change some of the reporting requirements with regard to security plan after some conversations or listening to some feedback from DHHS that requires it to be reported to some local county municipal police forces as well as local emergency management directors. There is also a deletion of some of the harsher penalties. There was the B1 felony issue that was raised. That section was deleted. The section was conformed to be with the penalties that we have for crimes or assaults upon law enforcement officers and other first responders as well. And there is a provision that limits the reporting period by AOC for a period of 5 years rather than indefinitely. There's another amendment that I want to point out to you that's on the final page. This is a specific provision with EMTALA, that's related to EMTALA, which is a federal law that would not bar somebody that's subject to a protective order from seeking emergency medical treatment. That was a concern that was raised as well by the hospitals and some people in legal when we were consulting and discussing this. Again, glad to answer any questions, but would ask for its passage.
Thank you, Senator Sari. Questions from the committee members on the amendment? Seeing none, we have a motion for a favorable from Senator Corbin. All those in favor, please say aye. Aye. Any opposed? The bill is back before you. Senator Sari.
Thank you, Madam Chair. The bill is substantially the same form as it was last week as amended. My other comment that I would make is that I think this is the beginning of a process. When I'm talking to my hospitals and local people that work in the hospitals, there are concerns with IVC, mental health, behavioral health issues that aren't necessarily being addressed here, and that's a bigger issue. It's going to be a bigger lift over the next year or two. It's something that I think we need to work through as a body and as a state. And I would also invite or intend to have a conversation with our district attorneys and some of our judges as well about how we can collaborate and make sure that we're holding some of these people accountable and properly getting the resources in the places that we need so they can enforce these laws and hopefully do so in a manner that makes it a safe environment for our doctors and our nurses and our other hospital employees to work, as well as getting the care and treatment of the people that need it. Madam Chair, I appreciate the opportunity to work on this and would commend it for passage.
Any questions from the committee? Senator Mohammed, you're recognized.
Thank you, Madam Chair. Just want to thank Senator Sari for the amendments. Appreciate that.
Any further questions Senator Mayfield.
Yeah, my understanding, thank you, Madam Chair. My understanding is that the audiologists have some concern with something in this bill. Is that right, or is that in another bill?
Senator Sorry.
They do. So yesterday at 5 o'clock, I received an email to all the health members on this committee, and we looked at it. We had a conversation. I had a conversation with some of the hearing aid specialists as well, reviewed some of the prior correspondence. It's been going back to March at this point, reviewed some of the correspondence from some of the trade groups. There's a discussion about a potential amendment to remove this section. I'll say in committee, I've said in emails to the audiologists as well, I'll work with you. I'm committed to doing so to make sure that's something that, we get right, but don't necessarily their concerns. I'm sure we'll hear from them here in a second, but I think the health chairs and Senator Adcock and I have had some conversations about that.
Okay, all right, thank you.
Any further questions or comments from the committee? Any members of the audience wish to speak? Seeing none, we have a motion from Senator Bergen. I will read Senator Bergen's motion if that's agreeable. Motion for a favorable report for the PCS as amended, rolled into a new PCS, unfavorable to the original, with leave for staff to make technical and conforming changes when engrossing the amendments, and a referral to rules. All those in favor, please say aye. Aye. Any opposed? The bill passes. Thank you, Senator Sorry.
I believe there needs to be a referral to judiciary as well.
Serial referral to judiciary and rules.
Thank you.
Thank you. That's not on my list, but we will certainly take care of that. Thank you. And I'm going to ask my colleague, Senator Bergen, to please take the podium.